QbTech, we believe the key to quality ADHD care is a well-informed diagnosis and reliable measurements of treatment response. With FDA-cleared QbTest, we provide the data you need to get a better view of ADHD. QbTest provides clinicians with an objective way to measure the 3 core symptoms of ADHD. In 15 to 20 minutes, the data needed for a more accurate diagnosis and effective treatment management is presented in easy-to-interpret reports that provide a visual comparison of the patient's symptoms. The test has 2 facets. The first is an infrared motion tracking camera that records the patient's activity throughout the test, which is then graphed and compared to an age and gender-matched control group. Hyperactivity data is important in helping rule in and out ADHD and remains a large differentiator between ADHD and other clinical disorders. The second facet of QbTest is an interactive task designed to challenge the cognition of different age groups. Patients are instructed to press a responder button each time a specified target is identified. For patients ages 12 to 60 versus those aged 6 to 12, a more complex task is presented. Targets range in shape and color and flash on the screen one at a time.
An evaluation at our clinic entails, first of all, the collection of a complete set of background information, and of course our QbTest, which gives us some objective data about ADHD symptoms. The QbTests are generally fairly easy to interpret. The information is straightforward. It gives you the information that you need. When a client presents with information on the report that may be a bit confusing, or there may be other information which leads us to think we need additional consultation, the clinical advisor is always available very quickly to help us figure that out. I would strongly recommend that other clinicians use the QbTest as part of their assessment. The QbTest results are data-driven, they're objective, and they provide a diagnostic profile of the symptoms commonly associated with ADHD.
While we all struggle at times to sustain attention and control hyperactivity and impulsivity, those with ADHD are more greatly affected and require accurate assessment and effective treatment. Adding FDA-cleared QbTest to your clinical practice can help improve diagnostic outcomes, streamline the conversation with patients, and provide reliable data to measure treatment effects. QbTest, a better view of ADHD.